So I spoke about shoulder osteoarthritis today. For those of you who don't know me, my name is Swati. I'm a physical therapist, and I strongly believe in patient education and teaching patients how to self-manage their symptoms and to let them know what's happening when they get a diagnosis. If you're watching me on the Facebooks, could you go over to my YouTube at the end of the video? I'll leave a link in the description, and if you like what I'm talking about and you'd like to be notified of future videos, just subscribe and press the bell icon on YouTube. For those of you who are watching me on Instagram, the link to my Facebook is on the bio, so you can take it on from there. Alrighty, and if you're watching me live, say hello so I know you're here. Or if you're on the replay, just comment hashtag replay so I know you've been here. Okay, so today's topic is shoulder osteoarthritis. Now, osteoarthritis is a very common condition and it can happen in any of the joints of the body. Now, usually when people think of osteoarthritis, they think of the knee joints. But then now we're doing the shoulder series, so I just thought to cover this topic here because shoulders can also get arthritic, right? So when we're talking about the shoulder complex, there are lots of joints around this area. However, when we're talking shoulder osteoarthritis, I am referring to this joint here where the long bone of this upper arm, it comes and attaches onto your trunk here, so which is actually um, sort of a round depression, like a circular depression rather, which is a part of your shoulder blade. And this long bone here has got a round head. So basically, the round head sits onto that circular depression there. So it was this shoulder, it would be like this. Okay, so what happens is this is called the glenohumeral joint. So that's just a technical term. You can call it shoulder joint. So what happens with the glenohumeral joint is like any other joints, big joints of our body, these the big the long bone here and the glenoid cavity, that is the part of the trunk where your long bone of the arm is attached, these are all covered with cartilage. So cartilage is like a cushion that is present on the joint surfaces, or you could think of it as like a shock absorber. So when there is a smooth cartilage here and there's a smooth cartilage on the upper end of my long arm bone. So when there is movement, so suppose I do these movements or any movements around my arm, there is a smooth gliding between between those two bones because of the cartilage. So what happens with arthritis is, I mean, there's a lot of things that happen, but one of the main changes that happens is this cartilage tends to get worn out, and it can either thin out or it can completely disappear, or it can have ridges like tears in the cartilage at certain areas. Now, what happens is there is pain and inflammation because of this lack of cartilage, because your bone on bone rubbing happens whenever you're doing your shoulder movements, right? Now, the body is always trying to heal itself. It's quite magical. It's got a lot of healing potential. However, in this case, the body cannot make cartilage. So what it does is it starts to produce some bone, trying to bridge those gaps where there is no cartilage or very thin cartilage. So, but in that process, what happens is these are like bony spurs that start forming on the humeral head or onto the glenoid, basically within the shoulder joint. And these become like thorn like projections, and they increase the friction between the bone on bone movement even more. So, in fact, it's detrimental, but then our body is just trying to cope up with the changes here, right? So, what will happen is you will have less range of motion, you will have stiffness, and when those bones are rubbing on each other, you will find that there's a lot of clicking or click 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 sound within your shoulder, something like when you click your fingers, you will find that sort of clicking within the shoulder joint, but definitely painful, right? When you click your fingers, it's not that painful. So this is definitely painful when you have shoulder osteoarthritis. Now, because most of the movements that we do in our daily activities, like if I'm, say, picking up a pen, or if I am, picking and putting something overhead, or any of the activities that we do, or I hang the bag on my shoulder, most of the activities that we do in our daily life will have some of the other involvement of your shoulder joint. So what happens there is, because you have osteoarthritis in your shoulder joint, even moderate osteoarthritis will give rise to a lot of pain during these activities. So that is why shoulder osteoarthritis can be very debilitating. Okay, so some of the risk factors for developing shoulder osteoarthritis will be if you've had a previous injury, like say you've had a fracture in this area, or you've had a dislocation in your shoulder, you're more prone to develop shoulder osteoarthritis as age related degenerative changes set in. So, see, degenerative changes will set into every part of, I mean, every joint in your body. However, you can't do much about it. Like, it's wear and tear that's going to happen in your body anyhow. So when that happens, what you can do is you can just try and excuse me, you can try and reverse. You cannot reverse those changes, excuse me. You cannot reverse those changes, but what you can do is you can try and give your body the maximal advantage you can. And how can you do that? I'll cover that. Going back to your risk factors is, if you have been playing a lot of overhead sports, or you are a throwing athlete, or you do a lot of tennis or badminton, those racket sports where you do squash, so there's a lot of high impact activity on the shoulder, you are also prone to osteoarthritis of the shoulder later on in life. Now, I'm just looking at my notes here. Yeah. So, the last one I wanted to cover was genetics. Now, there is a small role that genetics play in shoulder osteoarthritis. However, it is not like if my mom had arthritis, I will also have arthritis. But yes, there is a slight predisposition if you have a family history of arthritis. Okay, so how is osteoarthritis of the shoulder diagnosed? The doctor will obviously do an assessment, listen to your symptoms and what you're saying, your history of shoulder pain, plus X-rays. X-rays will show you the bone on bone uh, uh, I mean, a bone on bone scenario which you see in the shoulder osteoarthritis. If the doctor wants to look at more soft tissues like muscles, ligaments, etc., that are involved, or if you have any other shoulder pathologies, they will order MRI. They can also go for an ultrasound. Usually, MRI is the one that they would prefer. So, okay, so if you go to a doctor, what will they do is they'll give you medication for the pain. They can give you non-steroidal anti-inflammatory drugs, that's basically painkillers, and anti-inflammatory, to settle the inflammation in your shoulder. They will also give you topical gel, so you can use that. However, these are not effective long term. It's more for if I have severe pain, I put the gel and at least I can get through the day, right? So, another thing is steroid injections. So, as we covered in our other previous videos on the shoulder series, we've been doing this shoulder series, right? So, I spoke about it in frozen shoulder and in rotator cuff injuries, etc. Doctors will never give you a steroid injection more than 2 to 3, max 4 times in a year, because then it affects the muscles and the tendons in the shoulder, and it can lead to a weakening of those muscles. Okay. Um, Excuse me. Sorry, I don't know where this is coming from today. Okay, the weather's just a bit cooler here in Singapore than it usually is. Maybe that's why. All right. So another thing is hyaluronic acid injections. Now, when I say acid, doesn't mean acid, but it's basically a gel-like substance that the doctor can inject for you within your shoulder joint. So what happens is, going back to our anatomy, this is your trunk here, and this is the long head of your arm here, the long bone of your arm. So when this is sitting here, there is usually a cartilage layer, and then there's fluid inside the joint, right? So what happens is that fluid gradually dries up. So same thing happens in the knee when you have arthritis. So doctors can give you an injection of hyaluronic acid that acts as a lubricator within this joint. They say that it also initiates the formation of the cartilage within the joint. However, if you want to know more about these injections, you'd have to discuss that with your doctor. There are also some injections which are called as PRP, that is platelet-rich plasma injections, and stem cell injections. These are in the testing phase, rather they've been around for a while, but you will have to again discuss with your doctor or your orthopedic surgeon for this, because these are still not proved how effective they are. But there are quite a few people who go in for these, right? So what it does is restores your joint back to, well, it can't stop the degeneration, but at least it'll give you pain relief. Okay, so what are the surgeries that can that a doctor can do? It ranges from removal of the osteophytes. So remember those bony spurs we were talking about. So it can range from the removal of the osteophytes to total shoulder replacement. So basically, what that means is they replace the shoulder, the trunk part here from the shoulder blade, and they replace this long head of the round head of this long bone here. So again, you'll have to discuss this. There's a lot of factors that the doctor will consider before they tell you which surgery is suitable for you. So you'll have to again discuss this with your surgeon. Okay, so physiotherapy, whether you go for just medication, injections, or surgery, you have to undergo physiotherapy treatment. Okay, so one second, sorry. Really sorry about this. Okay, so what happens is physiotherapists will assess you. They will do a few tests to find out what's happening. They will give you some lifestyle modifications, which are very important. So if I have pain, say, coming to this range, and I keep doing this activity again and again, it doesn't make sense to keep introducing pain into your body, right? So a physiotherapist will guide you with your lifestyle modification. If this is affecting your occupation, then an occupational therapist can come in. I am going to do a blog on what you can do at home when you have shoulder osteoarthritis. So I will put in the link into my YouTube description under the video, so you can go on and have a look at that. It'll be, I think it should be up in another week or so. I'll put the blog in there. Okay, so if you're watching this in the future, it's already there in the description. So another thing is, what the physiotherapist will do is, our aim is to improve your joint mobility, to reduce your pain, and to strengthen the existing range. So if I can just lift my arm up to here, I have to strengthen my muscles within that available range, plus I have to strengthen my opposite shoulder. The reason being, whenever one side of your body is affected, you knowingly or unknowingly will work more with the other side of the body, right? So my opposite shoulder will also start to exhibit symptoms of pain and discomfort if I'm not careful. Okay, so that's one thing. So exercises. Second thing is, we can do taping to support the shoulder joint in a more neutral position or a more pain-free position. We can do dry needling. Again, if there are tight muscles around the area, we can work on that. Joint mobilization to introduce more range into the joint. Pain relief modalities, of course, to relieve your pain, right? So we cannot change. Yeah, I was talking about degenerative changes before. So we cannot reverse the degenerative changes that have happened within your shoulder. However, we can slow down the degeneration. uh, I won't claim that we can stop it, but we can sort of slow it down enough, to use your joint in a more um, pain-free manner. So think of, if you have an old building that's falling apart, what do you do if you don't want to knock it down and put a new one there? You put a scaffolding around it, right? You put those big bamboos and ropes and whatever you to support it. So if my joint has osteoarthritis, I do not want to get surgery done, or surgery is not an option for some reason, then what I'll do is I will strengthen the muscles around this area, sort out the muscle imbalances, strengthen the area so that my muscles can actually hold the joint together, who can support the joint better, right? So that is the aim of strengthening your muscles, and that's why you need to do it irrespective of what medical management, that is, whether surgery or injection or whatever. Yeah, another thing is, when you have a steroid injection in any of the joints, the pain and swelling goes down nearly magically, right? So that is actually a golden time for you to do the physiotherapy treatment. So if you have shoulder osteoarthritis, your doctor's giving you an injection, and you go home and you're like, oh, this is really good. I'm not feeling any pain, I don't need to do anything. That's not the case. It's a temporary stopgap arrangement. This is your golden time to do physiotherapy so you can build up on the existing muscle strength, etc., whatever we discussed, so that when the pain returns, when that medication wears out of your shoulder and the pain returns, you can manage your pain better. Okay, you can manage your condition better. Alrighty. So, if you like what I'm talking about and you would like to know more exercises for this condition or similar conditions, feel free to join my Facebook group. I'll leave a link in the description below. For those who are watching me on IG, the link lives in the bio. So you can go there and see my community. So we discuss these conditions in details. We discuss a lot more in that group. Like we did a simple hydration challenge to fix your posture challenge. So there's a lot going on in that group. So feel free to join that. And yeah, as usual, if you have any questions, please send them over. Ask, join the groups, and ask me there, or you can ask me here in the comment section. Totally up to you, whatever works for you. Alrighty, I'll see you guys when I see you next. Okay, bye.